Barbuda started work on the Tobacco Control Act in 2008. During the process, guidance was sought from other member states within the region who had tabled tobacco control laws. Using their country's experiences and advice, we were able to craft a powerful piece of legislation that would eventually protect Antiguans and Barbudans from the dangers of tobacco use. The country was successful in documenting their first draft bill in 2011. Due to the emergence of e-cigarettes, the draft was placed on a temporary hold. The Ministry of Health sought technical cooperation from PAHO to provide the needed help to strengthen the draft to become aligned with the WHO FCTC. This move, compounded with the strong advocacy from the PAHO Country Office NCD advisor, who met with the Prime Minister, was very instrumental in getting the bill to the Parliament. This garnered even more commitment from the government of Antigua and Barbuda, and 10 years later, on August 1, 2018, the House of Representatives successfully tabled the Antigua and Barbuda Tobacco Control Act. Our successes could not have been reached without the influence of the Antigua and Barbuda Tobacco-Free Initiative, which played a major role in advocating for the passage of the Tobacco Control Act. At the time, it consisted of persons from Health, Bureau of Standards, Customs, Police, Legal Affairs, and Civil Society. They were instrumental in putting out many anti-tobacco campaigns countrywide, especially within the schools and on the local media. One of their most notable activities was their annual No Tobacco Day march throughout the city of St. John's. After the passage of the legislation, the organization continued to be one of the major forces of accountability, implementation, and enforcement of the Tobacco Control Act. Careful planning and coordination played an important role in ensuring that this coordinating mechanism was multisectoral and protected from any external influences. The diversification of the professional and statutory roles of the members of the ABTFI ensure that the provisions within the Act are implemented accordingly. There was some notable interference from the tobacco industry during the draft phase and even after the Act was passed. Of note was the invitation by local distributors of one of the largest tobacco distributors in the region to present in Parliament in hopes to thwart the advancement of the Act. Their concerns were how cumbersome the warning labels are and the cost to companies to implement it. Despite this intervention, the Act defines the compulsory use of graphic health warnings on all tobacco products, which must cover at least 50% of the principal display areas of the package. After the passage of the Act, another regional distributor approached the Attorney General's office and requested a meeting with the focal point and the Minister of Health to discuss why filtered tobacco products should be excluded from being included in the Act. The focal point was able to reinforce that the Act has already been passed, making particular reference to Part 5, which speaks to government authorities limiting their contact with tobacco industry, and that all interactions must be transparent and well documented for public reference and perusing. Government gave careful consideration to tobacco control beyond the present time and chose to include provisions to prevent and control illicit trade, given the many factors present which makes the country vulnerable to being exploited in this manner. Antigua and Barbuda's location, limited human resources, tourism, and cultural diversity are mediums for encouraging illicit trade. In the future, we hope to be able to receive the necessary guidance and technical support to enact regulations which will create the mechanisms for ensuring that only legal, appropriately labeled and packaged products are sold in the country. Antigua and Barbuda continues to allocate resources to strengthen tobacco control, especially as it confronts the heavy burden of non-communicable diseases placed on our already burdened health sector. Draft regulations pertaining to the Tobacco Control Act are soon to be circulated for comments. Antigua and Barbuda is immensely proud of the strides that have been made towards strengthening tobacco control, and we look forward to a tobacco-free Caribbean. Now more than ever, we encourage other CARICOM countries to work together to strengthen tobacco control in the region, and Antigua and Barbuda is committed to providing any help that we can. I thank the WHO and PAHO for allowing us the opportunity to relay our experience, and more so for the help that they have continued to provide to us.